I think the lunch was very nice, so everybody is a bit sleepy, so we are trying to have a very interesting conversation over here. So let's start off with the topic of, I would like to thank all of you for attending this session, and I would like to thank Health 2 Conference for giving us the opportunity to present our topic for today, that is different stages of life. Now this is a very broad topic, so we have categorized the topic into technological afflictions at different stages of life. So before we start, I would like to introduce my panelists. Dr. Akshay Jadhav, next to me, consultant pediatrician and pediatric emergency specialist and intensivist clinical director for 2 healthcare solutions-based companies based out of Bangalore, India. Ms. Alida Mikovic, connecting startups, big corporate, healthcare providers, academia, and other stakeholders to support innovative solutions, mainly in medtech and health tech from Croatia. Mr. Hello. George Lee, hi. Founder and CEO of Mind Synergy Private Limited, that focuses on personal development and self-growth from Singapore. And I'm Dr. Paula Goel, pediatrician, adolescent specialist, US board certified in lifestyle medicine, founder and director of Faith Clinic Healthcare Organization, which is dealing with lifestyle diseases and medical diagnostic space from Mumbai, India. So let us first understand what are the different stages of life. Normally, when we speak about stages of life, there is a perception that there are 2 stages, childhood and adulthood. But we realize that we go through different stages and transitions in life as we move from one stage to another, physically, mentally, as well as emotionally. So with each stage, there are interest, actions, and behavior, which is very specific to that stage. Now, with technological innovations, life has changed dramatically, and that is very difficult to define. So we will try to break it down right from preconception to infancy, childhood, adolescence, young adults or youth, adults, and senior citizens. From every stage of life, we learn something, and then we go to the next stage, which actually makes us who we are. Now, when we are talking of technology, it has become a very integral part of our life and existence. And it is a necessity, no longer a choice. And technology in healthcare, as we are seeing from the last 2 days, has advanced tremendously. However, dissemination of medical knowledge, which was actually the prerogative of the doctor, and the doctor used to keep on giving you the medical advice, has now gone on into the digital platform where with a flick of your finger, you can actually access the internet and the knowledge. However, we have to understand that as human beings, we come in with our behaviors, our beliefs, and our thought patterns. And with that, let us see how our behavior shapes our health with technology. So the question is to you, Dr. Akshay. How does technology affect pregnancy and the exposure of mothers to physical and mental stress? Would you like to enlighten us on that?
Thank you, everyone. When we start the stages of life, just before the conception or preconception, that's where the life starts. Because basically, everything starts from there. If that part is perfect, only then the conception stage can be perfect. And then the pregnancy stage can be perfect. And only then the babies are born in a more relatively healthy way. And then we have the next stages. So neglecting that would be a huge mistake for us, even for the technologists, because that's where we have to focus from the beginning and then proceed to the next stages. So when we see the preconception or the conception stage, so preconception stage, there are many aspects which are basic aspects like the age of conception. Then there can be the nutrition part. And as Madam would later on elaborate, that nutrition is largely misunderstood, as malnutrition means, okay, there'll be like thin kids or thin people lying around maybe from like some part of the third world area. But malnutrition means they don't have adequate nutrition. They can be fat. They can be in different sizes, or they can look normal, but they are still malnourished or malnutritioned. So basically, that part has to be tackled pre-conception, or else we have seen many times the babies having neural tube defects, and many other defects, just because the nutrition at that moment was not good, and this has even caused multiple pregnancy losses. So nutrition part. So that is the most essential part here. So so the next comes then during pregnancy, trackers of how the food should be taken, the timings of food, the nutrition part. Then comes the vaccines which are mandatory to be taken. Then having their appointments with the doctors, having telecommunication or even a real communication after the first few real communications with the doctors in terms of COVID situation, and then having them at the end stage where you need more frequent conversations or telecommunications, wherein you need more diagnostic or understanding data, wherein you can have trackers. So trackers in terms of fetal heart rate, trackers in terms of mother's heart rate and stress situation, and then comes the final delivery stage or the perinatal stage, which again has a big role. So the technology there wherein they simulate or show to the mother beforehand through virtual simulations like what is motherhood, what is basically like how the delivery happens. So there are apps which can even simulate that and tell them, okay, this is what you are going to undergo, reducing their stress drastically. So that, and then coming, and then delivery, and then having the natal stage and the infancy stage, natal stage or the neonatal stage, basically from day 0 till 28 days, wherein we have the maximum amount of diseases. This again has more of tracking in the form of temperature, in the form of heart rate, respiratory rate, and saturation part. And then comes the infant stage, wherein other basic parameters like fall and other things are noted. So that is the physical aspect of conception as well as infancy. And this stage.
Yes, Dr. Akshay. So what I understand is that you're trying to tell us that a healthy mother will produce a healthy baby.
Yes.
And the mother has to take care during her entire pregnancy state and look after herself. And there are many mothers we see that they are hooked onto different media and gadgets.
Yes.
And how these waves would also affect them.
Yes.
Correct?
So the negative aspect of that is that because we have so many gadgets, most of them are hooked to phones, and they keep on Googling. I mean, so I'm at this stage of motherhood, I mean, what I should do, what I should do, what I should do. And they'll have 10 different answers, and they'll keep stressing about it. But more simplified, when they're using that gadget for few hours, so what happens to that? So definitely we have studies showing that the EMF generated or has so much negative effect on the pregnancy. So they have even done, like, if it is more than 6 hours of even TV time, simple TV time. So they have seen that most of the, they have seen that statistically significant, they have seen that babies are born preterm, and they are small for gestational age. So that is one aspect. Then other is like EMF directly generates waves like above 70 or 80 when it is there, which we have very commonly because everybody has now 5 gigahertz of Wi-Fi at home or 4. So which actually generates already like 2,300 megahertz of rays. And these rays are the most, I mean, the worst ones. They even cause, later on, like they have seen like from 3 to 7 years post delivery, they have seen that they are more likely to develop autism. They are likely to more develop hyperactivity. So these can
So
be,
you are trying to tell me that during the preconception stage, if the mother takes care of her own health, she can prevent a lot of problems coming up in her unborn baby.
yes.
Right, even up to autism, which we see in a lot of young children nowadays. And we all know as pediatricians that the level of autism has also increased. Okay, now Akshay again, to you the second question is, how does technology affect the health in infancy and childhood? As we all know, most of the children nowadays, right, from 2 months of age, the parents are putting them onto the media and to mobile phones. So can you enlighten us what is the effect if you put, and if I'm not mistaken, Indian Academy of Pediatrics and American Academy of Pediatrics states very clearly that you should not use media on children less than 2 years of age.
Yes.
And they have specific time codes set up
Even
for
beyond 2 years.
less than 2 years, no media.
Yes.
From 2 to 10 years, there is 30 minutes media.
Yes.
And from 10 to 15 years, it is 2 hours media. And from 15 years and above, it is 4 hours media.
Yes.
So there are very specific guidelines and rules for that.
Yes.
So can you tell us, with so many engaging apps and so many things which are available in the market nowadays, how does it actually affect infancy and childhood? And then we will see about the adolescence.
Yes, the direct effect of having screen time more Now, even like they have even made it 15 minutes for screens which are close to us. That is telephone, like smartphones as well as tablets. So 15 minutes a day, that's it. And why? Because this is a time they are developing their eyes. And when the eyes are developing, and we know that, I mean, we have like 4K screen or the best possible OLED screen, AMOLED screens in our phones. So that simulates 3D. It's not a real 3D. And a developing eye of a baby or a child, it falsely understands that, okay, this is the 3D, and it gets hooked to it. And when it actually tries to focus in a real 3D, it mistakes. It has difficulty in accommodation, what we call accommodation of the eyes. And then they have tremulousness of the eyes, and then difficulty in accommodation. Then the entity, we call it as astigmatism, which was realistically, I mean, even proven and seen in camps in India, in the western part of India, near Nagpur, post the first wave. Because everybody had to have, even the primary schools and secondary schools, they had to actually have homeschooling. And we cannot tell them to have laptops at home. So definitely they were having small screens, their regular Android screens, and they were all hooked to it for 3 hours, 4 hours, 5 hours. And then they turned out to be astigmatism. So what is astigmatism? It happens that they can't accommodate it, but what is worse, how to treat? We actually cover up their eyes for 3 months, one eye, and then allow one eye to accommodate, and then cover that eye, and then allow this to accommodate, which is like patching. You can remember Pirates of the Caribbean, right? So how can you actually make a baby or a child to have that and then be normal about it? Of course, he will not accept it. But why to go to that stage?
It's a very scary situation.
Scary
I think it's a completely scary situation for the parents as well as for the children and the other stakeholders.
Yes, yes.
So, anything else you would like to add to that, or I will move on to the next stage?
Yes.
So the next stage is, we have covered infancy and childhood, and the next stage comes to the adolescent age group. Now, let me share with you a case study. So I have been practicing as a pediatrician for the last 26 years, and for the last 15 to 16 years, I'm working specifically in adolescent and youth health. So this is one of my case studies, which I would be sharing with you. So one of my patients called Aaron, he's now 18 years of age. During the COVID pandemic, he had put on almost about 48 kgs in the last 2 years. And he had come to me when he was 13 years of age, and he was still overweight, but was not so bad. During the COVID pandemic, he put on about 48 kgs, and he became 148 kgs in weight. And his BMI was about like 46, which is an extremely grade 3 obesity. His blood pressure was 180 by 110. His HbA1c, which is your 3-month average sugar level, was 13.2. He was a clear-cut diabetic. And his lipids were way off the rocker. And so the question which came up was, how did this happen to Aaron? How did he reach such a stage? So Aaron is a typical teenager. He lives at the point where he likes to bond with his friends and go out and hang out with his friends, calls himself a cool dude. But during the COVID period, he was just stuck up in the house, and most of the time he spent on his gadget, and which was like about 15 to 16 hours, sometimes 17 hours out of 24 hours on the gadget. He loved gaming, so most of the time he's on PUBG. Maybe about 2 hours of academics, which he did, the rest of the time online friends and PUBG. And most of these people are on the social media and gaming, which occurs late in the night, so which means there is melatonin suppression. Melatonin, you would be aware, is the hormone for sleep. So if your melatonin is suppressed, you cannot sleep. And as a result of which, when melatonin suppression occurs, the doctors over here would know that your cortisol level as well as your ghrelin levels would increase, and they were chronically hungry. So they'll end up overeating, and this guy would get up at night 2:30 a.m. and make himself a meal and eat it when his parents were sleeping. Now, food was easily available because he was in the house. Parents wanted to get him out of their hair, so they always topped up on his mobile wallet. So with all different apps working, Swiggy, Zomato, and the different food apps which are available, it's so easy. You can order food by just a flick of your finger, and money is available, so easy availability of food, no physical activity, huge amounts of time which is spent on the social media, and as a result of which, what do we see? We see so many parameters which have gone wrong, so much of craziness which occurred. And if you look at it, these were the problems which used to occur in the 50s, which came down to 40s, and we see young people as young as 13 to 15 years of age who have this problem. And you even have people who are having a heart attack at 27 to 30 years old. Why? Because the disease process of lifestyle diseases starts off early in the teenage years, but is not manifested. It manifests in your late 20s and early 30s. And that's not it all, it's just the physical component of it, where you have your diabetes, early diabetes, and blood pressure, and sugar, and also cervical spondylosis. He developed cervical spondylosis by looking at his gadget, and this is also the age of growth. So even though he had grown physically, his mental growth was still occurring. So the brain matures at 25 years of age, and amygdala is that portion of the brain which is still active, and it binds with your emotions. So that's the time when PUBG played a big important role. So they are so hardwired. And not only Aaron, a lot of the children and the teenagers at this time, because everything was closed, they could not go out, they became hugely aggressive, and their aggression, which used to come out on the field, started landing up on their mothers at home. The girls started actually physically abusing themselves by slashing their wrist. So it was really a crazy, crazy situation which they went through. And because there were so much on the social media, there were problematic social media users, which landed up with anxiety, panic attack, and depression. And not just that, they developed more of virtual friends than real-life friends. So there was an emotional disconnect, lack of relationships, social and coping skills also got affected. And this led to so many physical and emotional health problems, body shaming, and so many other things which occurred. So it was really a difficult time. And what made it even more difficult was that they required some help and support, which we will see later how they are able to do with it. So let us look on. So preventive care is very important for this age group. So let me ask the next question to George. How has the media use affected the different age groups emotionally?
Right. Well, I'm not a doctor, so I look at the issue from a practical point of view because I'm a practitioner. I run a school that trains coaches that handles emotional, unstable clients or kids. Now, if you look at emotion as an overall topic, it is the underlying state that we do everything. Whatever we do or don't do, there is an emotional pack to it. Some people fall back to gadgets because they feel bored with other aspects of their life. Some people feel that the gadgets that they have in their hands is giving them more pleasure. Some of them, they use it correctly, and sometimes we use it wrongly. Now, if we look at gadgets on an overall emotional aspect, we got to admit that it is giving us the good and the bad. Let's look at just teenage and adults separately. Well, the stage that I'm in now, it's I transited from the days where we had absolutely no internet to one which now internet runs almost every aspect of our life. Compared to my kids, they are literally born into a stage where internet is everything. If you to take away internet, take away Wi-Fi, take away their gadgets, literally their life will collapse. So emotionally, they are very much addicted to that small little phone or that big laptop that is in front of them. Adults like us, we actually live through the days where we were doing A-OK without internet, without Wi-Fi. So if it ever comes a day where these gadgets are taken away from us, I guess emotionally we are better able to handle it as compared to the kids. Now, compared to the older folks like my parents, they are the ones who are pretty much, it's a general observation, they are pretty much quite resisting the inset or the ingress of technology. Some of them are resisting learning about technology, about internet. They are asking questions like, why are we learning all this? It's almost the age of my life, and I just want to live life peacefully. Not realizing that without learning the gadget, in the future, they are not going to get a future life. Because a lot of things, like it or not, is going to be technological based, it's going to be virtual based. Having said that, there is this aspect of technology which, as far as I can say right now, that hasn't been fully and 100% digitized, is the emotional part. So we can rely on technology and virtual to do a lot of things. But if you look at the emotional aspect, when people get connected digitally, they get disconnected emotionally. Now, how many of us in this room right here, the person could be just sitting next to you or probably 2 or 3 tables in front of you, but instead of walking forward to speak to that person, you choose to fall back to the glass screen that's in front of you and send him or her a text message. It's like literally the fastest way. You can reach someone who's at the end of the room like instantly. But the fact of life is when people connect digitally, they fail to see each other heart to heart. And that is exactly what's causing the emotional distress when people start working from home. Now, I'm not sure about the rest, the part of the world that you're in, but coming from Singapore, which is pretty much a developed country, we are finding clients which are falling back to the good old days where it's like we are connected, but we are not connected. It's a paradoxical symptom. It's quite ironic, but I guess it is a very worldwide symptom that you are seeing in your immediate environment right now. So how can we actually resolve this emotional debate together with the advancement and the introduction of technological improvement? I would say that there is no best solution until the time where we can digitize emotion. Then I would say if AI or virtual is 100% the way to go. Until then, like what one of the earlier panel speaker mentioned, we still need that human touch. Now imagine this, if you have a psychological issue and you call up a hotline and the hotline is being answered by a computer. It's not going to help. Like, if you feel distressed, press 1. If you have suicidal thought, press 2. If you thought of killing someone, press 3. And then after pressing 1, 2, 3, okay, if you think of killing someone right now, press 1. If you think about killing someone 2 days later, press 2. If you think of killing someone 2 weeks later, press 3. And then after 1, 2, 3, okay, so if you think about killing the person in a more humane way, press 1. If you think about cutting his throat and stuff like that, press 2. That is exactly what's causing the problem. Like, we are looking at the problem thinking that it's a solution, not realizing that the solution is also a problem in its own. So emotional needs becomes both a science and a non-scientific topic.
George, let me ask you one question, now that we are on the point of emotions. Do you find that adults as well as children, they become very angry and abusive if they are disconnected from their gadgets? Do you feel that there is a conduct disorder which is developing not only in the adolescents but also in adults?
I would answer the question from a very general perspective. Now, if anything were to be taken away from you, you would feel angry. That is like when you're aware that something has been taken away from you. But what the gadget has technically done is to take away that human-to-human connection without us being aware that it has been taken away from us. So, coming from a very practitioner point of view, what I do in my day-to-day business, what I do in my day-to-day school, what I teach and what I train, is to let people become aware. And once you're aware, then you make a more conscious choice. Is this gadget that you're choosing right now? Or do you want to choose to mix with your friend outside, get into the nature, go into the jungle and just connect heart to heart? Where the jungle and the sea is the best place because you have no internet connection, you have no Wi-Fi, you have absolutely no one but the human being that's next to you, and that's where you can really connect heart to heart, people to people, and human to human.
Thank you, George. The next question is to Alida. Can you tell us the impact of technology on the health of adults and senior citizens?
Yes, of course. Thank you very much. So Building on to what George said a minute ago, alienation is a huge problem. And of course, technology impacts all of us. It does impact adults. Who here can function without technology on a daily basis? Who here could check into their hotel without providing their email address? It's impossible. Now, the moment when it does come possible is when you're elderly. Because maybe life slows down a little bit, and you are sometimes not even able to use the technology for whatever reason. The alienation that here occurs comes from the adults, and it comes towards the children, but it also builds towards the elderly. So if you're not on a device, if you're not on a platform, you're shut out. And in that age, that is something that I'm not sure what comes worse, right? Like health issues, sure, but those are usual. When you don't have anybody there, that's a big one. Moving forward, fear of missing out. It's a true one, it's a big one, and it's an emotional one, right? And it's everywhere around us. And it leads to depression, and it leads to all sorts of mental health issues and so on. And it's difficult to cope with because you still cannot refuse to be on those applications fully, right? But also the concept of social interaction changes. So if you're sitting in a waiting room, you're most likely not speaking to anybody. You're on your phone and you're avoiding contact. Coming up with younger adults, so kids that did grow up, like myself, with the gadgets, it's normal. It's almost the way we know, and it's always been like that. So even when somebody does speak to me, I get a little bit shocked for a second, no? Think like, okay, well, what do you want? What's the problem here? But yeah, and it leads to different types of physical issues as well, being behind the phone all the time, eyesight problems, or in my case, with COVID pandemic and working hours not really being a concept anymore, and me choosing to spend my free time behind the computer as well. Even though I was an athlete all my life, I developed back problems, severe back problems
Yes.
at 25 years old, no? That shouldn't be happening so early.
Yes,
And
so-
I did break out of it, but that's...
Yes, so cervical spondylosis, lower back problems, joint problems, trigger fingers, trigger thumbs are very common in all meteors, orthopedic problems. Huh? Yes,
Exactly, yeah.
yes.
Really, WhatsAppitis.
Right, WhatsAppitis, right. So the next question is to Alida and George. Media addiction, when we are talking about, occurs at all age groups, right? Right from children to senior citizens. Yes, senior citizens are also having media addictions nowadays. And some of your grandmothers also could be media addicted, if I'm not mistaken. Okay, so how can technology assist in healthy living and prevention of diseases?
Shall I kick it
Yes,
off?
please.
Well, obviously, there are many useful aspects of technology, and healthcare probably has maybe the most potential of bringing it back together. My work focuses on digital health, and one of the trends that we saw coming up and that today was spoken about a lot is, of course, telemedicine. And that goes in several ways. One is the interaction between the patient and the doctor or the healthcare provider. And for example, one of the solutions that came to us recently is a Greek startup called Melapus. And what they do is they provide mental health counseling via platforms, so everything is online. And in their case, they also use AI-powered solutions and face recognition to help the therapist understand better what is going on the other side. Now, they are successful, not maybe entirely because of this reason, but partially, I would personally believe so, because when it comes to mental health issues, as much as awareness is coming up, if I'm behind the screen, I didn't have to go there physically, I didn't have to, in a way, expose myself. So that's for example, one of the things. Another thing is social support, and I believe there was talk about that earlier here as well. So, for example, post-operation care. You go back home, care at home. If you're elderly, it's a whole different set of problems, but either way, unless you have a strong support system, you're basically on your own. And another solution that came through was Kindful. What they do is they really make it easy to create these so-called care communities. And the care providers can keep track, because they track the data that goes through the app, the usage of the app, so they can track the engagement and so on. And they've been doing really great as well. So, of course, there are very good aspects to it, and remote patient monitoring and so on. Stuff like that drops.
Hybrid care, because
Exactly.
maybe one or two can be a real one-to-one visits, and then followed by telemedicine care.
Exactly.
Wherein,
Yes.
I mean, we know the patient, we know what has happened, and then we are following up when they're becoming better.
Yes, yes. And we can lower, certain stuff, like we can optimize resources, we can have fewer hospitalizations, and at the end, better care outcomes, which is what we want to, no? It's all about that.
And even post-op
Right.
care with a gadget in their hand. Again, elderly, they may not remember to charge the gadget, they may not remember much of the things, wherein, again, that whole process falls back. So what we can add human touch to that is neighborhood watchdogs. So neighborhood, in their neighbors, whoever is close to them, who usually talks to them or is around them, or who can see them through the window and then, say hi to them. So they will be their tags. So they'll be, taken up, and then they'll be allowed to actually ask. They'll be asked like, okay, I feel that, it's switched off. Can you please, see what's happening? So that way you can ensure, because many times it happens that elderly are alone. So they may not have even their own children nearby. So that way the neighborhood
Watchdog would be very helpful.
Yeah.
And since we are talking on this, even for the teenage group, we know they are peer-driven. So the entire problem of PUBG and all that works because of peer-driven. But instead of using PUBG, they could do for a more social cause, so that they have working beyond themselves, so it develops a eudaimonic and happy feeling. So it actually helps to cut out on the disease process. We at Faith Clinic are also running many online programs for PCOS and hypertension and diabetes for the youth group and the teenage group. And the whole thing works on a peer-based model. Along with the digital technology and the teleconsultations, it works beautifully. So you have your counseling and you have your in-house apps and models which are there, which allows them to track how much of food they are taking, the exercise they are doing, and they can also give a peer group support to each other. So a lot of these apps and a lot of these things can actually be helped to gauge and work on. George, would you like to add something?
Yeah, I seriously support technology in helping helping people improve their life. It's only when people start abusing the technology and allow technology to run their life, and that's where they become addicts to technology, addicts to the gadgets that they have in their hand. And I believe that as much as books can change a person's life, education actually changes a generation. So it is important to take on any new change of form, any new change of technology advancement and improvement with an educated mind. It's important to train the people with the right mindset that this piece of machine is here to help us improve our life and not to lose our life over this piece of machine. Now, as I'm speaking right now, there are a lot of kids that I know of, my kids, for example. If you were to take away the mobile phones from them, they will throw a tantrum, they will get angry. But I guess it is that, like what Alida mentioned, that social support, the environment that is there to emphasize the importance of human connection, getting away. Now you need to have time that you get away from the technology, because if not, your whole mental state is going to go haywire. Your physical shape is just going to follow suit after. And that's what technology brings forth, the good and the bad side of being too dependent on it. Now, I spend more than half of my years working and fighting in the Singapore military. So as a military man, we always fall back to basic. Now, what happens if one day all your communication set fail, your technology fails? What would you do? Because if you stop doing what you need to do, lives will be lost. And that's where that fundamental fallback to basic has to be implanted in every single life, every single mind that we have, especially to our kids today, as they step into the world already open up to technology, what happens if they don't have that mobile phone? What happens if they don't have internet and Wi-Fi? How can you still get your books
Right.
covered?
Right.
Education, yeah.
Thank you, George. So, Dr. Akshay, this is the last question to you. With multiple gadgets overcrowding the markets, do corporates investing in technology need to work with doctors to have a social responsibility towards community?
Yes, absolutely, because many of the tech companies, I don't know whether there is a hesitancy or they feel that doctors are busy. Because I am busy too. I'm always busy. I'm a pediatric intensivist and emergency specialist, but I still am in the board of like two companies which are doing tremendously well. And one of them is tele-ICU based primarily, and then we are also providing software solutions and app-based solutions for many of the care providers. But what I make sure is that I bridge that gap, because I can ask the right amount of questions to the final end user, like how he wants, and I can probably give
The
a
doctor,
little better
you mean
medical answer to that.
The doctor.
Yes, a doctor, so that I can find a medical, points or like the summarized points from him, and then tell the technologist, because I've learned, languages as well, and I can code as well. So I can actually tell them in a little better way that, okay, he needs this, so focus on this. Don't focus on something which he may never use. And largely we see that, the biggest of the big companies, they never ask, or they ask and they forget what they've asked, and they do something what they want to do. So that actually, it irritates us as doctors when we use the solutions, but we can't do anything because there's no other option. So finally, if we don't make something which we use, it's always going to be like disengagement between doctors and the technology usage.
So you're trying to say that the tech companies must make doctor-friendly apps.
Yes. And
Doctor-friendly
yes,
softwares.
Yes. And
Tools.
and many doctors actually, they feel scared.
Yes.
Okay, how can I talk to a technologist, because I know nothing about technology.
Yes.
But they
do.
need, and they really don't need to know anything about technology. They have to just answer the right questions. But there has to be a medium or a person or a doctor who can tell them what those questions are. Because there are technologists who need doctors' help. So there has to be a bridge always.
Yeah, so in order to sum it up, I would say technology is an absolute necessity, and it is a very integral part of our life, but it is necessary to be educated on all aspects of technology. Technology is a very powerful tool if used very wisely, and it can be used for patient diagnosis as well as treatment, but if not used widely, it causes a lot of damage. We have the blue zones of the world where technology is used very wisely, leading to sustainable and healthy lives. Even the Dubai Expo, there is a large amount of technology which is being used with sustainability and with a significant amount in healthcare which is invested in that. Finally, we need to understand that technology and all the different AI models, they have to be a bridge between the patient and the doctor. So yesterday when we spoke and someone did ask, how are you going to overcome the problem of lesser nurses and lesser doctors? The idea is, if you have a good technology which is going to aid the doctor and not going to scare the doctor is going to use that particular software or app and reach out to more patients. I have patients from Canada and different parts of the world, and I'm connected to them through technology. So technology plays a vital role, provided we are able to bridge the gap between the patient. But however, we need to understand that the human hand is very important, because it is the empathy and the understanding of the doctor which is finally going to reach to the patient. Technology is going to aid both the patient and the doctor in reaching the right outcome of the disease process. So with this, we come to the end of our panel discussion. Thank you so much for your patient hearing, and we are open now for questions.
Yeah, just to add one more thing. There is one aspect in the mental health wherein, Alida has done quite a bit of work. So if you can enlighten us about like use of musicology in different stages of life, wherein it can help work in a better way in tackling mental health, with or without an actual counselor.
Of course, yes. So when it comes to children, it is really a catalyst for development, because it develops coordination, it develops emotional expressions, it develops creativity, and you have to perform all of those at the same time, right? So mental capacity, mental stability, stepping on a stage, starting from the beginning to the end, seriously and for the people, right? So all of that together, memory and so on, we see children, and I worked I worked mainly with preschool children. When it comes to musical education, I played the violin. So I taught kids, and it's incredible when they are, even if they're hyperactive or not so focused, and you get them to focus for those 30 minutes consistently on a weekly basis.
Yeah, absolutely, because I'm one of the examples. Like I was always on the go. I was really, active, proactive. And my father, who's here right now, he's a gynecologist and a fetal medicine specialist as well. He thought that, okay, let us see. He taught me piano. And then at 1.5, 2 years of age. And that suddenly changed my whole perspective. I was trying to think and act. And that changed the whole process of life. And now even I create music. So basically, every part of my life or the decisions, there has been music which has even helped or even de-stressed me quicker.
Right. Any further questions? Thank you so much for your inputs. Any questions?
Hello, can you hear me? Thank you so much for the panel. I'm Nitya. I'm a mental health professional. I'm a rehabilitation psychologist. The question from me is for Alida and George. Both of you can find some space to answer. I really listen to it, right? So I'm trying to run a tech company. My co-founder is from tech. I'm from psychology. So I'm always telling him, but psychology, you can't expose people to so much technology. And he's always like, but that's the future. You can keep harping on about your stuff, but that's really the future. And one of our big dreams is accessibility, and I come from India. And accessibility in India is a super thing, and one of the big parts of accessibility is affordability, which is what technology does for us. It makes whatever solutions we have affordable. So how do I find the balance between, yes, I can't do this for more than 30 minutes for kids, but that's really the only way they have to access good mental health care. That's some of the only places I have. So I'd really love from George if you could give me a little bit of idea, because I know you work with children, and from Alida, if anything.
Well, thanks for the question. If I were to understand it correctly, I would ask myself in another way, how can I actually teach the kid the right way of using technology? Now, if we were to look at mental health as a psychology versus technology, can psychology go along with technology, or is it either or? Can we actually educate the psychological part via technology or not? Now, I have another way of looking at things. If you guys can actually recall, like Save the World, right? On a particular day of each year, we actually switch off electricity at about 8 p.m. just to go green. And the exact message is actually sent using energy, electricity. It's quite ironic, it's rather paradoxical, but it is the way that you can reach out to a mass number of people in the shortest possible time. Now, I'm not taking away the fact that that is a good benefit of technology, but we've got to draw a very fine balance. And the best way to educate any kid is actually through its environment. The environmental education is, well, like it or not, we are all a victim of our environment. If you want to educate your kid in the way you want him or her to be educated in, you jolly well got to put him or her at a very young age into an environment that has to be the way of nature. Because kids today, right now, being born into a developed country, the environment, now straight away, the moment they start breathing air as a young infant, it's technology. At the hospital bed, it's all gadgets all over. How do you actually change a person to move away from the very first instinct of environment into someone that is pretty much more healthier? So parents become the key decider. So parents, given the choice that we can make with the ability that we have, right? I believe all parents want the best for their children. Of course, the government, the society, the social support, like what Alida mentioned, has a huge part to play. And all these evolve into this thing called environment. So if you don't want your kid to be in developing a behavior that you don't want him or her to continue on into the future, create an environment. Now, I believe in creation. In this room, we are all creators. We are designed to do something big for the world out there. And that's why we are all gathered in this room tonight, this afternoon. So if the kid can see this possibility to create their own future, that's where they are empowered to take their life into their own hands and know that the gadget that they have, technology, is nothing but just an enabler. It's not a controller, it's not an inhibitor, but it is an enabler for them to create something bigger. So education, environment, parents, all these are intertwined into one big ecology. So I hope I've answered your question.
If I may add one point over here. So when you're talking about mental health, from the medical point of view, mental health is a very broad topic, but it is very loosely connected nowadays. We just speak of mental health in a very loose way, but that's not it. So if you ideally have to understand which person is to be put on an app-based model, you actually need to run certain tests, psychometric tests on them. You should run a PHQ-4 or a Beck's inventory or some of the tests on them to identify what level they are in, and then, depending on the score, decide whether a few in-house intervention is required, or a teleconsultation is required, or an app-based model is required. Because otherwise, it is not really going to help if you put a person directly into app-based model. Also, secondly, another important fact is when we talk about technology, again, it is very, very loosely used term, because technology means anything and everything. Technology means including this mic, including this glass, including this table, including this room. Everything is technology. But what causes addiction, what causes damage to human health, that is what we need to understand from the medical perspective point of view. Yes, Alida?
I agree completely. And, you know, as George said, it does have to do with the environment and what you're exposed to on a daily basis. In my opinion, from an early stage, the child should be involved in as many activities as possible to keep them active all day long and to keep them developing new skills. Because once they grow up, what will happen? They will fall back to those skills. They will be maybe professions, maybe hobbies, maybe something that they just enjoy doing every now and then, but they will have something to do. If we neglect them at that age, they grow up, they don't know anything, they have to pick up everything from zero. Whatever they pick up is causing extra stress because they're not good naturally, you know, they never picked up and developed skills at a young age.
Exactly.
So it's much more difficult to have a pastime that you enjoy. Now, if you develop those, and in my case it was sport and music, I always have an instrument that I can pick up. I always can, you know, train or do something, and that keeps me.
So I think we've run out of time.
Yeah,
She's
just one
waiting
addition,
here.
I think, for the app makers, I think there is a right point which was made by everyone, that the disconnect from the environment is critical here. And we know that everything which we focus on is what we see on the screen, right? The app is entirely screen-based. So why not make it as like a podcast-based or like instruction-based or only audio-based models? So that when the child is first exposed to an app, let it be, okay, first instructions, then the screen switches off, and then it's all audio-based or like instruction-based model.
Podcast-based.
Yes. So that the instructions they have to follow, they have to do something in the real life, and then they have to continue. Maybe that is one of the ways we can focus on.
So thank you so much for your patient hearing.
Thank you.
Thank you very
And,
much.
I hope we were able to get through. Thank you.